We ready? Good morning. Javier Becerra, Chairman of the House Democratic Caucus, joined by three of my colleagues, Jan Schakowsky, Suzan DelBene, and Bonnie Watson Coleman. We will be very interested to see what goes on in that building over there as much as we are interested in what's going on in this building back here. And that's because this is an important month. It's the beginning of Women's History Month. And maybe ironically, or maybe justly, we should be focusing on the rights of women, the achievements of so many leaders of this country, at a time when so much of what we've built up to give women equal rights is now under attack in this building and possibly in that building. And what we're here to say is that we should elevate all Americans, not diminish their rights. That some of this is being done politically by House Republicans in impaneling a sham committee that essentially is a witch hunt on Planned Parenthood. And it strikes me as rather odd that the Republicans are being so oblique in the name of this particular select committee, which our colleague from Illinois, Jan Schakowsky, will lead Democrats on, because we have to be on guard on what might be done. But it's interesting that Republicans have now shied away from calling this what it is, a witch hunt on Planned Parenthood. Perhaps it's because all the investigations that have been done, all the judicial proceedings that have taken place so far, have found that the culprits in what's been going on involving fetal tissue have been the actual people who are protesting against Planned Parenthood. And they're the ones, these protesters are the ones that find themselves under indictment. In the Supreme Court, it's interesting, this body on the other side, the Senate Republicans, have decided to cripple the Supreme Court by not moving forward a nomination by the president to replace deceased Justice Antonin Scalia. And it's strange. It's strange, it's eerie, and it's unfortunate that Senate Republicans think they can keep justice from moving forward by trying to cripple the U.S. Supreme Court. And we're hoping that tomorrow, argument which will be heard on a very important case dealing with women's health, will demonstrate that regardless of the politics that Republicans play, that we will still see justice prevail in that Supreme Court building, and hopefully soon justice prevail in this building here as well. With that, let me now yield to someone who's been a champion on these issues and will be on the front lines in making sure that the work done by the sham committee is actually work and not political scapegoating. Jan Schakowsky.
Thank you. I'm so happy to be here with Congressman Becerra, our caucus chairman, and also two of the members of the select panel that will be holding a hearing tomorrow at 10 a.m., Suzan DelBene and Bonnie Watson Coleman. So the hearing tomorrow of this select panel, which the Republicans call the Select Panel on Infant Lives, or on their website, the Select Panel to Investigate Planned Parenthood, the panel that we call the Select Panel to Attack Women's Health, because that is really what it is. But it's more than that now. It is also the Select Panel to Attack Scientific Research, the ability to conduct research with fetal tissue, which has long been supported by past, including in the Reagan administration, and current members of Congress, including the chairman of the Energy and Commerce Committee, who wrote in the 90s, dear colleagues, calling it pro-research and pro-health to do research on fetal tissue. This is what the release put out by the chairwoman of the committee, Marsha Blackburn, the select panel, said that the committee is being convened tomorrow to, quote, consider ethical issues surrounding procurement and selling baby body parts, unquote. Now, if that phrase rings familiar to some of you, that was the phrase echoed by the shooter in Colorado Springs who killed 3 people at a Planned Parenthood clinic saying that this was, that no more baby body parts. This is a dangerous investigation that's going on. And especially to the media, I want to point out to you something that you may not know that they're doing. They have issued now subpoenas asking for the names of researchers, even medical students, of doctors who may perform the legal procedure of abortion. They are creating a database, which I would say, and asking for names. I would equate this to the McCarthy era, when give us the names of people who are communists and the kind of attacks. But in some ways, this is even more dangerous. You should know that right now there are websites, I'm not going to say the name, that list the names, addresses, home addresses, phone numbers, and directions to the homes of abortion providers in this country. They have the photos of these people. Next to one that was murdered, they have the word inactive, who was murdered for being a provider of this medical procedure to women. This is what the Washington Post said accurately about the collection of that data. The Washington Post said, Democrats on the panel have decried creation of such a database, they're talking about the database of names, which, without rules to protect it from public disclosure, risks individual privacy and safety without legitimate reason. How is the name of a graduate student who 5 years ago was an intern at a lab that does fetal tissue research relevant to anything? And that is why the Washington Post and many others have called this a dangerous witch hunt. Democrats from the start have said that we should not impanel this select panel. And now we are seeing that it is nothing more than a partisan and dangerous attack on women's health and on legitimate and life-saving scientific research. Shame on them. The women of this country, the people of this country are watching, and they don't like what they're seeing.
Suzan DelBene.
Hi, I'm Suzan DelBene from Washington State. 43 years ago, the Supreme Court ruled that women have a constitutional right to decide whether and when to have a child, and Americans overwhelmingly think that was the right decision, and I agree. But according to Bloomberg News, at no time since 1973 has a woman's access to reproductive health care been more dependent on her income or her zip code. Politicians across the country are passing dangerous laws to block women from exercising their constitutionally protected right to choose, and their efforts are working. As the Supreme Court weighs the whole women's health case right across the street, I hope justices recognize that these shameful attacks undermine Roe v. Wade, put women's health at risk, and must be struck down. A woman's right to make her own health care decisions means nothing without the opportunity to exercise that right. If the court upholds these harmful laws, it could pave the way for restrictions at the federal level, and Republicans are already trying. 4 months ago, they established yet another taxpayer-funded select committee, this one focused on attacking women's health. Its first hearing is tomorrow. And as a member of that committee, I can tell you Republicans are already using it as a political weapon, as Congresswoman Schakowsky indicated, to imitate healthcare providers and patients across the country. Women deserve better. They deserve the freedom to make their own healthcare decisions. Thank you. And now I want to introduce the Congresswoman from New Jersey and also on the Select Committee, Congresswoman Bonnie Watson Coleman.
Thank you, Congresswoman. Over and over again, we've seen Republicans try to legitimize the attacks on women's health care. They claimed that HB 2 in Texas was about making abortion safer. And now they're planning to create the same veil of legitimacy with attacks on fetal tissue research. This time, they're not just attacking a woman's health issue. They're risking the solutions to some of the most devastating diseases of our time that affect all people. and can affect all people. The Supreme Court has ruled that women have the right to an abortion, and President Reagan's own blue ribbon panel on fetal tissue research confirmed the safety, necessity, and benefits of this science. This week, the court hears a new challenge to women's health, and the outcome of that case is at risk because Republicans continue to block President Obama's attempt to name a successor to the Supreme Court jurist from the great state of New Jersey, Anton Scalia. These are very, very, very serious threats to women's health and to everyone's health. We will be, we will be participating in a panel discussion to talk about the efficacy, the efficiency, and the validity of fetal tissue research, but only as a ruse to determine whether or not Republicans still can get at attacking a woman's right to choose. So we need our communities to understand that what Republicans are doing now is not just an attack on a woman's right to choose, it is an attack on overcoming and finding the solutions to very important and serious diseases that take lives and severely impact the quality of lives. We think that this is enough, and we're going to stand up for all of the women and for all of the people that benefit from this scientific research. Thank you.
So as you can see, these dangerous attacks against women, these tactics of intimidation for women who try to exercise their rights to have decent health care have consequences. We're here to say that we want to make sure that we're able to defeat these attacks and these tactics before they have real consequences on the lives of American citizens who happen to be women. With that, we'll take any questions that you may have. Yes.
Hi, I'm Penny Star with CNN.
Nice and loud, nice and loud.
Okay, if Planned Parenthood is doing something that you're saying is ethical, why would they stop doing it? Because after these videos surfaced and controversy,
Jan, do you want to?
stopped. They said they were going to stop the practice.
No, they stopped taking money at all. Look, Planned Parenthood has been investigated and exonerated by 3 House committees. 12 states did their own investigations. And amazingly, the grand jury in Texas that was impaneled in order to look at misconduct by Planned Parenthood ended up exonerating the accused and indicting the accuser, those people that doctored those tapes. Planned Parenthood was never engaged in anything that was illegal. That has been very clear under the law. That making a profit from fetal tissue sale has always been illegal, but covering the costs of preparing that and delivering it to the researchers has always been legal. Let us hope as Americans that we are allowed to continue with fetal tissue research. How about Zika, which actually deals with fetuses? Explain to me how we can prevent these fetal abnormalities if scientists are prevented from doing fetal tissue research. It's impossible. Not to mention Alzheimer's and diabetes and even an Ebola vaccine where fetal tissue is needed.
Isn't Connie any further response?
No, okay.
See if there's any other questions. There are none. Yes, Mike.
With this budget debate coming up, all kinds of obviously conservatives tried to put these types of provisions into the budget bill for years. With this investigation going on with the Supreme Court thing happening, there's only going to be more pressure on them to do it. How are you going to navigate this and not allow those types of provisions to get in there without having to go?
Is there a budget?
We don't have a budget yet.
Anyone wish to
Well,
respond?
let me
We'd like
just
to have
say,
the discussion.
well, first of all, they were supposed to vote on a budget. There was supposed to be an agreement on the Republican side on their budget. We have not seen a budget. It is unclear whether or not there will be a budget. But it is absolutely true that there have been efforts to shut down the government by attaching these kinds of riders. I, for one, cannot understand the politics of this. because I believe, and as Congresswoman DelBene mentioned, the women's health, access to clinics, access to reproductive health is popular in this country. Continued and upticked attacks on women's health, the uptick in violence that we're seeing at the clinics is not doing them any favors. I think they should drop these kinds of efforts. But who knows if we'll ever see a budget from them? They're having a hard time.
But you're going to see appropriations bills. That's what I think.
Oh, on the appropriate. And we certainly have seen these kinds of riders attached to all kinds of bills. I expect that we will see this again. Do the Republicans really want to prevent funding the government over these kinds of issues? We've seen them in the past finally decide that it did not suit either the country's objectives or their political objectives, and I think we can successfully challenge those efforts.
Bonnie, do you want to add something?
Well, in terms of the services that Planned Parenthood provides, taking away funding takes away women's ability to access cancer screenings, immunizations, basic health care. And that's what we're fighting for. And that's what we'll continue to fight for if they try to put riders in appropriations bills or anyplace else.
And Mike, I'll just remind you and others that Republicans are always trying to include their social agenda in what is a fiscal measure. It has nothing to do with setting social policy. It's our budget, and it keeps the services and programs moving, whether it's filling potholes or providing the school dollars that our kids in school need, or funding NIH to do the research that keeps us all in better health. Or the Department of Defense. You move through it. That's what the fiscal measure is about, not about whether you are supportive of the Republicans' extreme agenda. The interesting thing is, on these fiscal measures, Republicans can never, even though they're in the majority, provide the votes they need to pass these measures. And so every time they try to lard up these fiscal measures with their social agenda, they still can't get a majority vote in the House. And so they're going to have to turn to Democrats, as usual, to pass a responsible budget. And there's where we believe we're going to continue to fight, as we always have, to extract from any fiscal measure these extreme social agenda items that have nothing to do with funding our government. And so we'll continue to fight. I think you can see clearly from my colleagues here that we're going to stand firm to make sure that we don't allow Republicans to inject their extreme social agenda, especially when it attacks women and women's health, on a must-do bill that passes and funds the operations of our government. And so I think we're going to continue in that vein.
And
Bonnie?
particularly during this period of time, Congress members are very concerned with what's going on outside of the walls of Congress. And as they pay attention to trying to be successful in what they're trying to do now, they're going to recognize and continue to recognize in a very intense way that there is a general support for women's health and the kind of services that Planned Parenthood renders to women and to even men, particularly in underserved and in rural areas. And so as they go out and meet with constituents, even the constituents in their districts have a vested interest in seeing that healthcare services available to women should not be diminished in any way.
Let me also say, make no mistake, this isn't just about Planned Parenthood, and it's not just about abortion. The Republicans in the House of Representatives have already passed legislation that would allow states to defund any clinic, not just under the banner of Planned Parenthood, if they provide abortion services. But it also is a war on contraception. Because that is what many of these clinics do a great deal of. And let's remember that access to contraception actually reduces the number of abortions that are necessary. So this is a broad sweep against women's health, against all the clinics, and not just abortion rights.
I think that's a very important
And if there are no further questions, we'll go ahead and conclude here. Any final questions? Okay, thank you all very much, and I thank my colleagues.
Thank you.